Hi, I'm Perry Atkinson, General Manager here at theDove. Hey, check out our other videos and check out our website at thedove.us. Well, welcome to Focus Today. I'm your host, Perry Atkinson, and delighted to have in the studio, as always, Dr. Joel Klein. He's with us from Ventana Wellness, and we're talking about folic acid today. And interesting topic, because earlier, Dr. Klein, I said, that's vitamin C. Then I was corrected. It was vitamin B. And I thought, well, BC, that's close enough. No.
Yeah, it's good.
Why did you select this?
So I thought that because this has been getting a lot more press recently, although it's actually a 45-year-old story, of the role that the genetic differences, it turns out, in the way that people use folic acid. Actually, should be folate. Folate is the B. It is a B vitamin. You know, the B's is a whole family of vitamins. We have, you know, well, you can number them: B1, B2, B3, which are thiamine, riboflavin, niacin, B12. People, because they don't want to really say, cobalamin or however, or pyridoxine, which is B6. So it's a whole family, and the folate is a member of that family. Folic acid is the chemical form of that vitamin that is typically used in supplements or added to food. And we're discovering that genetic differences in the way people use it and metabolize it are playing a huge role in increased risk of a number of problems, including cardiovascular disease, maybe even cancer, depression, and of course we've known for a while now that issues that have to do with deformities in newborns in the brain and spinal cord. But the cardiovascular and depression thing is getting a lot more press now.
Okay, so is that why we need it?
Yes. Well, one of the thing is, without getting too complicated, one of the main things what folate does in terms of metabolic reactions in our body, it's what's called a methyl donor, but this plays a huge role in the regulation of our genes. The way our body biochemically turns on and off genes, and I think we've talked on this on the show before, about how it's actually not what's in your genes, but how they're read and how they're turned on and off that they have discovered is the issue. So what's in our genes may be the hardware, but it's the software of how they're read that actually makes the difference. And a big part of that has to do with things that we get from folate.
All right, so you're seeing it packaged differently, Super B's, in the store, and
well, that's been for decades and decades. I mean, this has been, this was all based on very good science, but bad things were done on it. This is Roger Williams, Linus Pauling, going back into the 1940s, where they noticed that enzyme activities, if they just measured, they didn't even know what DNA structure was then. This is before Watson and Crick. But they noticed in healthy people that enzyme activities could vary as much as 200-fold in normal, healthy people. And they realized enough, they didn't know how, but that was due to genetic differences. So that if you had a weaker form of the enzyme genetically, you can accelerate the rate of that enzyme, or actually you could increase the byproduct by increasing what the vitamin uses, the enzyme uses. And all these B vitamins are cofactors in all these metabolic enzymatic activities in our body. So they realized that people were deficient, or they had a sluggish form of the enzyme. If you give them more of the vitamin, it can compensate for that. This is where all this came from in the first place. And actually Roger Williams wrote an article in the New England Journal of Medicine in 1949 suggesting that if we could map out people's genetic differences nutritionally, we could custom design nutritional programs for them.
All right, now before we get into the dosage, can you OD on B?
Certain ones, yes. It's pretty hard. What we found is that the main thing, you can OD on anything. Right. The biggest issue is mostly what they've come out with, because it would be really hard to OD on that. You can OD on folate. People estimate that our diets going back may have had thousands of micrograms in them, because it comes from leafy greens, which we used to eat a whole lot of. So now basically what we eat is iceberg lettuce, which doesn't have very much of it. So, but B6 is one you can OD on. That people found when they took way too much of that, it actually caused neurologic problems.
All right. So what foods do contain it?
The leafy greens are the primary source of folate.
All right. Now, I have a little pet peeve here, so forgive me if I shine in on this too hard. But are we really getting the nutrients in these leafy greens if, in fact, they're coming from other countries and how they've been treated by the time they get here?
I think it's more the stuff we're growing here. We're growing crops differently than we have for thousands of years. We're growing the same crop on the same plot of land for productivity issues, so you basically deplete that soil. Right. We're not rotating crops. We're not allowing fields to go fallow, as we've known for time, so that now the vegetables, the plants are actually devoid in these nutrients, and they get depleted from the soil over time. Right. And yes, so that, you're right, that's an issue.
By the way, that's a biblical thing. You let a field go.
Absolutely.
Yeah. All right, so organic, is that better?
Organic we think is better. Now, people are testing this as well. The thing about organic is that what we know is that stressed plants, I think I've said this on the program before, botanically, stressed plants make more of these nutrients that we need. Most of these nutrients are defense chemicals for the plant. So when you take away all the stress from a plant, it doesn't make these nutrients. It can put all its effort into growth, which is actually more carbohydrate.
Okay. Before we get into the dosage and everything,
right.
How do we know that we're low on B?
This is the big issue. So what's happening is now, we've had blood tests. You know, there's a certain way, not everybody needs to do this, but you can now do blood tests. Of course, we've had this one blood test, again, goes back to 1969, that this doctor at Harvard found that elevated levels of a compound called homocysteine in the blood increase risk of heart disease independently. Well, the homocysteine builds up when you're not getting enough folate for your genetic type. So we've been able to do homocysteine tests for decades. And that's one of the markers. What we're finding is that the two worst genetic mutations of this enzyme that people have that really can affect their folate, we can do blood tests for now. Okay. So people with family histories of coronary artery disease or people with cardiovascular disease, you can do this homocysteine test. And then people with depression or other what they would call neuropsychiatric problems that aren't responding normally, you can now do the genetic testing for these mutations. That's what's really coming about now. And now those we know we have to give more than even the normal vitamin supplementation to folks.
Okay, because B is also being used for stress, right?
Well, it's depleted in stress, so we need to use more of it when we're under stress.
How do you know what number to select between the B's and the 12s and the 6s?
For maybe 20 some years now, functional labs can do these tests that are still considered experimental, where you do a 24-hour urine collection for all these different metabolic compounds. And based on that, let's say if you either have high levels of one compound or low of another, they can work back in the biochemical pathway and say, aha, see, with these things going on, you're likely deficient in this because this is a cofactor in this, and this. So there's expensive medical testing that can be done. I wouldn't do it unless somebody was very sick. Yeah. So it's good to cover the bases, but with the folic acid issue, we have, especially if you have one of these problems that we've linked to it, we have blood tests that we can do to see, aha, you really need to take a much higher dose of folic acid, or actually there's a new vitamin form that wasn't available until maybe the past 5-10 years that can bypass the sluggish part of the reaction for people.
All right, so a multivitamin's probably not going to get it.
Not for people who have the mutations, and that's the issue. That was the one thing I wanted to address this morning, and I'll be frank, I haven't tested enough for this. I think I need to do more testing in my practice. Okay. Now that I've looked at this, and I really ought to do it for myself. Okay, we'll do physician heal thyself. There you go, because I have some issues there. So people with these kind of medical problems that aren't responding, or have, like I say, the heart disease history, although to be fair, so far when they've done supplementation with people with heart disease and all that, the studies have not been they haven't been consistent. So there hasn't been a clear cut, oh wow, this really works. I think it's a factor. It's certainly, and doctors, I was just listening to a doctor who does functional treatment of Alzheimer's at UCLA using all these different things that we've talked about for 2 years now, or you've talked for longer with Nisha about the anti-inflammatory diet and all these different markers, and the homocysteine is one of them in actually reversing early Alzheimer's. Really? So, so for some of these issues, it's hard with the multivitamin supplementation. You're right. We really don't know There's levels that people have looked at, but what I wanted to make sure is that this issue, if people have heart disease, family history of heart disease, depression, family history of depression, or other mental illness issues, we can now do blood tests to see if this is a factor. And there are people who don't respond to any antidepressants, and it turns out they have the mutations of folate, and you give them high doses of this special form of folic acid, and they get better.
Okay, what about this cocktail shot that they give you in the rump before?
Oh yeah. So we got the B12, the kicker.
Yeah.
Again, it is not a panacea, but see, there are a lot of people who are depleted in Bs because of stress.
Yeah.
B12 deficiency gets more common as you get older because we don't digest it in our stomach as well. Right. So a lot of people can get benefit for that. It is not a cure. It certainly can help folks if they're deficient. It's certainly not a panacea, but it helps a lot of folks.
All right. Dr. Joel Klein's with us. We're going to take a quick break. We'll come back. We'll talk about the dosage and some areas for you to consider. If you take on a multi, you may want to say, well, maybe not the multi, maybe I'll take some B and C.
Or you just want to take a good multi, and that we'll talk about when we get back.
All right, we'll be right back.
Yeah.
Welcome back. Dr. Joel Klein's with us today from Ventana Wellness, and by ventanawellness.com is the website, and let me encourage you to check it out. They got a great resource. Their clinic is expanding. You're full service, everything, right?
We're doing more and more, and we're actually interviewing people for even more services.
Really?
Type of things that we want to bring as much in-house as possible with our own people.
I will say this, that Ventana Wellness has found the balance between natural health and Western medicine. I mean, you guys have really figured out.
And that's what I've been trying to do for the past, especially 14 years, is really find the best balance. Not everybody, I tell people, if you're drowning, I don't have time for swimming lessons. So people are really in trouble. We don't use supplements right off maybe we need to use medicines to get you out of trouble and then try to look for a better longer term approach.
Well said. All right, so we're talking about folic acid, vitamin B, how much, when, how. Now, going into the break, you said yes, a multivitamin should still be in the diet or still be in the plan.
I think so, because I just take a B because I do these green smoothies with all these organic veggies and all this other stuff. So,
yeah, you look great. How much weight
still
you lost?
Well, that was different. I lost about 17. No, I gained 3 back in Mexico.
You look great.
That was
so vitamin multi.
Yeah, the regular. I don't want to use brands because we'll get into trouble. But the regular cheap things that you just get in the drugstore, for the most part, depending the cheap things, the brands that everybody's heard. Says more doctors, recommend this. Well, that's because. No offense, but doctors don't know very much about nutrition because those are the only ones they know about. Yeah. So they'll say those, but those usually are poor quality, not only in doses, but also in the form that things are in. It also depends, the chemical form, particularly that minerals are in, will determine whether you even absorb them. So it can be in the vitamin, but your body won't use them. Okay. So a lot of the better brands that are usually in health food store, vitamin stores that are more complete multivitamins, a lot of people go for these whole food types of vitamins. And those can be really good. But the problem is what the RDA is, the recommended daily allowance, is just enough to keep you from getting a deficiency disease from that vitamin. It is not enough for optimal function. This has been the discussion for decades and decades and decades that people don't understand. And the doctors will just say, well, you're just making expensive urine. But it's not, and this is what we found for optimal function, particularly, let's say, like folate. The RDA, I think, is 400 micrograms or maybe even less than that. We find people with this condition may need 15,000 milligrams of the active form of folic acid to take care of these genetic things and something like that. And there are companies that are making those supplements now. There are also medical food that, of course, costs a lot more money because the drug company had to get FDA approval for this form of what's called L-methylfolate. Brand name is Deplin, but it's usually a lot more expensive, and insurance doesn't cover it a lot of the time. So, but you can get the good vitamins from different places.
All right, I have noticed a difference in stress when I take a Super B. I mean, it does chill me out.
Right. Well,
I mean, I don't feel euphoric, but I notice that my MO is different.
Most of the B vitamins, zinc and magnesium, are the big 3 that are depleted in stress.
Okay.
So those are the ones that most people need to, would do best at a minimum supplementing, even if they're not doing all of the others. If they're like most of us, if they're blissfully doing their spiritual meditations and they're living in prayer and bliss, maybe they don't need to do that, but most of the rest of us probably ought to be doing that.
Okay. All right, so how much B?
Well, that's this is the issue, because again, there's a whole family of 13 or I don't know how many different Bs in there. If somebody wants to supplement, they'll usually you'll find something called a B50 or even a B100. It's a 100 milligram that I would have people take one a day. They put those sometimes they'll make these called stress Bs that have the vitamin C in them as well. Again, the good multivitamins, which you're never going to get a good multivitamin that you can just take one pill a day. There's way too many things that you need, so it's usually going to be one of these. You got to take 4 or 6 of them a day, and people got to go, wow, I got to take 4 or 6? Wow, to really get decent nutrients. And some of those nutrients, like calcium and magnesium, take up a lot of physical space in a capsule. So there's only so big you can make the capsule and put them in there. You're going to typically get better doses. So it would be hard. I would have to have even a sheet, and I usually have to have a sheet in front of me to run down. I know basic doses of some of these things, but we have to run down, okay, how much thiamine, how much riboflavin. But those B50, B100s are a good place to start if people want to supplement a whole B complex, because most people need that.
Okay, because you see them with different levels, and
right.
I never knew with the 6 to 12 which one you want most of.
Yeah, well, you don't. Well, that's the thing. Hopefully good companies are doing a good balance. The only difference is now B12, which we can do blood levels of, especially as we get older and don't do well. The problem is we don't absorb it from our stomachs as well. So people that I want on B12, I will use a tablet that dissolves under the tongue, which typically comes in 1,000 micrograms. There are some you can actually find 2,500. Since those have come out in general, I have rarely had to put people on B12 shots like I used to when they were deficient like that, because those sublingual tablets for under the tongue seem to work really well.
All right, I'm just making a little list here. All right, so if you're going to be healthy, in all of our discussions, today's B, we've talked about C, we got to do some D.
D, and typically 2 to 5,000.
Magnesium and calcium.
That's what I'm saying. So if you're buying a really good supplement from a really good company, and then most of those things are going to be in there. Or usually, again, because it's so much, you may have to buy, and this is why companies make these, but again, this is a whole long discussion about what form they're in. They'll do a whole multi, and then have a separate calcium, magnesium, zinc supplement for that. So you sometimes wind up actually need to do 2 things.
And by the way, the magnesium, calcium, zinc, you should have those. Those should happen all the time.
Well,
right?
That's debatable too. We've pushed this
calcium business.
calcium
Do
business.
the calcium without the magnesium and zinc.
And the calcium by itself actually is a problem. And again, doctors don't have a clue, but it can actually cause increased irritation in the nervous system, stone issues, and all the rest of them. Calcium, we pushed this so long, and in Britain, again, because they have an economic stake on what they pay for in their national health system, has looked at this, and they've really found that people need maybe 750 milligrams of calcium, and this is even postmenopausal women.
Wow.
And you get that in your diet. All this calcium supplementation stuff that we have just spouted for years probably doesn't have a great deal of evidence to it as what's really needed, but the magnesium is the problem. Magnesium deficiency, insomnia, palpitations, spasms, tremors, all of these different types of things, anxiety that I have found related to magnesium, and most of the magnesium supplements out there have a hard to digest form of magnesium. It's the cheapest one they get, called magnesium oxide. Magnesium citrate's okay. You find better what are called amino acid chelates. I know we're getting more technical here, but they're bound to amino acids. So you'll see something called magnesium malate or magnesium glycinate. These are more easily digested by people. Most of these cheap ones you'll see, it's all magnesium oxide, and unless you're 22 years old, you're not going to digest magnesium oxide very well.
All right, so what are the signs of B deficiency?
That can be anything. I mean, most people will know it's fatigue. Obviously fatigue, brain fog, but again, those are also hormonal, so this is why we have to kind of address everything, and it's difficult to do. But those will be usually some of the big ones, is concentration and memory. Mental functioning and energy are going to be some of the bigger ones that people will notice.
So fatigue, that happens a lot.
Right. Migraine headaches actually can respond to higher doses of vitamin B2, riboflavin. Sometimes that's been noted.
Does folic acid have any kind of contribution for or against cancer?
Yes, because it's gene regulation. And what happens in genes? We have mutations. So genetic issues, there are some evidence of folate playing a role in cancer or anti-cancer. Again, it's not going to work. You just don't take folate if you have cancer. But as part of a general regimen, if you want to try to do the best you can for nutritional cancer prevention, yes, folate would be one of the big ones in there because it is absolutely involved in genetic translation and maintenance of genes.
Wow. All right. I know it wasn't on our thing, but I'm just curious because we're going into, we're 20 days away now from spring. Good weather. Is B something that helps with skin issues and sunlight and all that? Not,
everything helps with everything, but those would not be my go-to, the first things that I would think of when you think of allergies. Allergies, more vitamin C, helping stabilize these mast cells and histamine.
Because
and
things are
some other
blossoming
things.
now. People are starting to sneeze.
Yeah, it's already. Again, remember, guys, I'm a little bit newer here, so when I see daffodils in February, I'm kind of stunned. Where I lived at 7,000 feet, they came up in April and they always got snowed on.
Yeah.
So it's a little bit different.
Yeah.
But yes, I wouldn't. While these are important, I wouldn't say these would not be the first things I would think of if you're talking about allergies in general, eczema issues.
Okay. Because people are starting to sneeze now and,
right.
and clog up with all
those can actually, vitamin C, quercetin is a vitamin, what's called a bioflavonoid that is helpful with that, the herb stinging nettles. So some of these companies will make supplements with quercetin and stinging nettles in there together that can help people with allergies.
All right, back to the cocktail shot
that
had the B in it.
Right.
I had it. I had that shot about 4 days before I ran the Pear Blossom. This was years ago when I used to run. Wow.
Yeah. So again, this is not a panacea for everybody, but that meant you were depleted.
Really?
Sure. Yeah, it's not like it's going to give you energy just by itself.
No, but
typically.
the endurance level was terrific.
That's the whole point. You were depleted already. You didn't know it because it's subtle. These are subtle reactions, and that shot got you for temporarily back up to a healthier level where you could perform at a better function.
All right.
Sure.
And they're good for what? 2 weeks, 3 weeks?
Well, depends.
Yeah.
I've had some patients over time that needed to do them more frequently, but we typically because for insurance coverage and some other issues, we were only able to do them every 2 weeks.
Low testosterone and B, is there a connection there?
Not connection, but certainly will add up synergistically to making you feel bad. Sure, okay. They both deal with energy.
Okay.
So now I'd have to research my biochemistry to remember if B's play a role in any of the testosterone or hormonal biochemical synthesis things. I'm not so sure. There may be a role in there, but certainly together they will multiply each other's effects.
All right. Well, Joel, you're a delight.
Okay, thanks. Always happy to help and try to be a.
Well, you're inspiring. And I really appreciate his approach to medicine, and I want to encourage you that if you don't have a good doctor, here's a good one, and check it out at ventanawellness.com, ventanawellness.com, and really a balanced approach to your health. And what I like is you guys always do the blood thing. I just think blood's kind of like the
it's really
the manual
helpful
to what's going on.
Yeah, but it's a guideline. The more I've done this over 33 years, there's a lot of times when I tell people I have to actually even enact this ancient esoteric medical technique I call treating the patient, not the lab test.
There you go.
Because the people tell me what's going on even more so than the lab sometimes. But we use them both.
Check it out, ventanawellness.com. Thanks, Joel.
Great, thanks, Barry.
We'll be right back.